Keeping in mind the two standards of care, we will review borreliosis treatment, both looking at the IDSA guidelines, the Infectious Diseases Society of America guidelines, and then looking at the ILADS, or the International Lyme and Associated Diseases Society guidelines. And then we will move on to looking at templates that I use. First, we'll look at IDSA CDC guidelines treating Erythema migrans, the Lyme rash. So each of these slides will include adult dosing and recommendations and children's dosing and recommendations. I will review with you the adult dosing and recommendations, and then basically for most of these slides the children's recommendations is a mirror with different dosing, so please just note that for any medical providers here. So first, to start out with, doxycycline is most typically used for an Erythema migrans rash, which is diagnostic of Lyme disease, 100 milligrams twice a day for 10 to 14 days. Next, amoxicillin could be an alternative. You could use that at 500 milligrams 3 times a day for 14 days. And finally, an option is using cefuroxime, 500 milligrams twice a day for 14 days. Next, let's look at the IDSA CDC guidelines for the treatment of neurologic Lyme disease. First, facial palsy. For adults, we would use doxycycline at a dose of 100 milligrams twice a day for 14 to 21 days. Next, for Lyme meningitis or radiculoneuritis, we would use doxycycline or ceftriaxone. For adults, we would use a dose of 200 milligrams per day orally, divided into 1 or 2 doses of doxycycline for 14 to 21 days. Or there is the option of using ceftriaxone, and that is an intravenous drug. 2 grams intravenously once a day for 14 to 21 days. Next, the IDSA CDC guidelines regarding Lyme Carditis. The first table looks at mild, first-degree atrioventricular block with PR interval of less than 300 milliseconds. The antibiotic options include doxycycline, amoxicillin, and cefuroxime. Doxycycline is recommended at 100 milligrams twice a day orally for 14 to 21 days, or an option would be to take amoxicillin 500 milligrams 3 times a day for 14 to 21 days, or cefuroxime 500 milligrams twice a day for 14 to 21 days. Now moving into Table 2, severe symptomatic first-degree AV block with PR interval of greater than or equal to 300 milliseconds, or for second or third-degree AV block. These are the recommendations. The CDC recommends ceftriaxone, which is an intravenous drug, taken 2 grams once a day for 14 to 21 days. Next, we have Lyme Arthritis per CDC guidelines. The oral antibiotic regimen for Lyme Arthritis includes using doxycycline, amoxicillin, or cefuroxime. And the dosing here would be 100 milligrams of doxycycline twice a day for 28 days, or 500 milligrams of amoxicillin for 3 times a day for 28 days, or cefuroxime 500 milligrams twice a day for 28 days. Next, Table 2, there is the option for intravenous ceftriaxone. That would be recommended 2 grams daily for 14 to 28 days. Let's talk about post-treatment Lyme disease syndrome, PTLDS. This is a term coined by IDSA and the CDC. They say patients can sometimes have symptoms of pain, fatigue, difficulty thinking that lasts for more than 6 months after they finish treatment. Continued antibiotics are not recommended. Discussing symptom management with healthcare provider is recommended. And they acknowledge the cause is unknown of why these symptoms can persist, which of course I see all the time. with these short regimens of the antibiotic therapy that are recommended by the CDC. So the theories include there may be an autoimmune response that has happened, there may be persistent Borrelia infection, and other unknown causes. Next, let's look at the ILADS guidelines. Evidence indicates that 20 days of prophylactic antibiotic treatment may be highly effective for preventing the onset of Lyme disease after known Ixodes tick bite. So we talked about that earlier when we talked about how to treat a tick bite. Now also they say patients with early Lyme disease may be best served by receiving 4 to 6 weeks of antibiotic therapy. So with the CDC guidelines, we saw a range of somewhere between 10 and 28 days. ILADS guidelines recommends at least 4 to 6 weeks. Cases of chronic Borrelia burgdorferi infection require individualized treatment plans. I see that that is very important regarding how long we treat, what we use to treat, etc. So let's remind ourselves about this shapeshifter, Borrelia burgdorferi. It can persist by changing forms, becoming dormant, and protecting itself within the host. On the left we see the spirochete. In the middle we see the cyst form, also called the round form. And then we see the cities that it creates with biofilm, the biofilm that it puts around a community of spirochetes on the right side. So we're going to use those principles in creating our treatment plan. Now I'm going to review templates that I use for years treating patients with acute tick-borne disease. So here we will talk about acute Lyme disease treatment. First, I would recommend doxycycline, 2 100 milligram capsules twice a day. So that's 400 milligrams once a day total, broken up into 2 doses, with breakfast and dinner. I would recommend eating with doxycycline because it can be really hard on the gut, and I see a lot of side effects like nausea or vomiting or abdominal discomfort. But you must avoid products with high levels of calcium, magnesium, or iron, for example, dairy products, almond products, and acids, within 2 hours before or after the doxycycline. So it's not like you cannot eat those foods or take a multivitamin, but just make sure to separate it out from the doxycycline. Avoid the sun while taking doxycycline due to the increased risk of photosensitivity. If doxycycline cannot be used for an allergy or whatever reason, if the patient is not tolerating it and you need to switch, you can use cefuroxime and azithromycin, or either or, right? There are appropriate alternatives. And during the summer, due to intense photosensitivity at this higher dose that I use of doxycycline, I tend to use cefuroxime. And that dosage would be 500 milligrams twice daily. Now, depending on where you are in the world, right, maybe you're near the equator, and doxycycline would be a really tough one. So the patient would need to not go outside at all during most of the year if they live there. If you're more in Canada, Northern Europe, etc., then that window of time where there is much sun sensitivity that's going to create a terrible sunburn is much more limited. So take that into account. Next, I recommend Nystatin, which is an antifungal prescription. You take 2 500,000 unit tablets twice a day with breakfast and dinner. And then to make sure to get to the round form of Lyme, we would add something like the Lyme Borreliosis Formula 1 or grapefruit seed extract. So whereas the doxycycline or the cefuroxime or the azithromycin are coming in to kill the spirochete form, we need to make sure to add something to get to that round form because they will not address that. So the Lyme Formula 1 has cat's claw, Chinese cat's claw, Japanese knotweed, and andrographis. All equal parts, 1 teaspoon in water 3 times a day, 30 minutes before breakfast, lunch, and dinner. The other option is grapefruit seed extract. I recommend a particular brand called Allergy Research Group, and the product name is paramicrocidin because it does not contain benzakonium chloride. Now there's discussion about grapefruit juice, of course, right? We know can be an interaction for many drugs. However, grapefruit seed extract in itself, when you're taking it from that part of the fruit, it does not create the same interactions as grapefruit juice. However, benzakonium chloride does. So some people use benzakonium chloride to extract the grapefruit seed extract in their products. And then, as a result, we get that same interaction with certain medications, that certain effect that happens on the liver. So if we want to steer clear of any drug interactions, if somebody's on other medications, we want to choose a brand that we know does not use that chemical, benzakonium chloride. And Allergy Research Group paramicrocidin does not contain that chemical. So, with that said, you would take one 250 milligram capsule twice a day with breakfast and dinner. Okay, next, this is an option. You may want to support the person, especially if they have Bell's palsy, severe neurological issues acutely. If they're just having a hard time, if they're immunocompromised, we might want to add a certain support called Lyme Borreliosis Formula 2. This is more of an immune and neurological support tincture. So it includes Japanese knotweed, Puraria, which is also kudzu, Salvia militariza, which is also called red sage, and Scutellaria bicalensis, which is Chinese bical skullcap. So all of those equal parts, take 1 teaspoon in water 3 times a day, 30 minutes before breakfast, lunch, and dinner. Next, I recommend Serrapeptase. This is an anti-biofilm agent. So far we have talked about killing the spirochete form, getting the round form or the cyst form, and now we must add an item to address the biofilm. So Serrapeptase is 500 milligrams or 120,000 units twice a day, 30 minutes before breakfast and dinner. Now, if you take this with food, it will digest protein. We are not trying to do that, so it is imperative that you take this on an empty stomach. Next, finally, probiotics. I recommend greater than 40 billion organisms daily, 2 hours before or after antibiotics. And remember, this is a template for the beginning of treatment, right? So we're talking about acute tick-borne disease here. We're talking about how to get started. This is a 1 month protocol that I start patients with. And then we want to keep in mind, we're going to treat 2 months past the resolution of symptoms. So patients need to track their symptoms, and you need to come to understand when they're resolved and then treat 2 months past that. You could continue using a similar protocol, but I recommend changing the treatment after that first month. And typically I'll move on to natural therapies after that, and there are many options for that.